Today we're going to do arterial blood gases. The physician has ordered this on a patient, so we would check the patient's chart, look to see if they're on any blood thinners. If they would happen to be on blood thinners, we just need to hold pressure longer after the needle stick for that patient. So I would head to the patient's room. Hello, Mr. Blank. My name is Trisha with Respiratory Care. We're going to get some arterial blood gases today. This is going to show how effectively you're breathing, and this is going to be different from a regular blood draw. It's going to be a little lower on the arm, and it's going to come from an artery and not a vein. So first we're going to perform a test. I'm going to wash my hands, put my gloves on, and then we're going to perform a test to make sure there's enough circulation within that arm. So we're going to place the patient's arm on a little towel, just relax that hand, and then I'm going to have you put pressure on the radial and the ulnar artery. Can you make a fist for me? And then go ahead and release that fist and see how your hand is blanched, not a lot of color. I will release the ulnar artery, and we know that there's enough circulation because the color returned immediately. We want that color to return within 5 seconds, so this arm is appropriate. So I will get my supplies. We have a needle, an alcohol pad, a gauze pad, the Band-Aid, a cork device to put the needle into, and then a device to take the bubbles out following the needle stick. With the needle, we are going to pull back just over 5 cc's. 5 cc's would be enough, but we want to get just a little bit more than that. We would prepare the patient's arm. We would rub in a circular motion for 30 seconds. And then clean fingers. And then I'm going to palpate. I would place my hand in the palm of the patient's hand to steady it. Palpate that artery. We're going to go at a 45-degree angle. Bevel side up. We'll go into the skin. We'll watch that blood fill to where we had pulled back, and then we will apply pressure as we remove the needle. Hold pressure for that 3 to 5 minutes, or we would go anywhere from 5 to 10 minutes if they are on a blood thinner of any sort. So we would hold that pressure, put our needle into our cork device. Then we would look at the site, ensure that there's not a lot of bruising. If there would be a hematoma, there looks like there's a hematoma, we would place some ice. Then we would put the Band-Aid on the skin. Then we would use the device to get any bubbles out of the syringe, and we would get that sample to lab.